Okay, today we're going to talk about some different PNF stretching. We're going to talk about 3 different techniques that are typically used. Before we begin, we're going to first talk about antagonist versus agonist contractions. So the first thing when we talk about PNF stretching, an antagonist contraction, that is always going to be talking about the muscle that is being stretched. So for this demonstration, we're going to stretch the hamstrings. So the antagonist muscle is going to be the hamstring muscle. The agonist muscle is going to be the opposite. It's going to be the one which we're going through the range of motion. So if we're going to hip flexion, the agonist muscle is going to be the hip flexor muscle. So now what we're going to get Olivia to do is just bring her leg up straight through hip flexion, and we're going to do a hamstring stretch. So we're going to go to a point of mild discomfort. Here the first technique we're going to do is the hold relax technique. When we say hold in PNF stretching, that means an isometric contraction. So what we're going to get Olivia to do is she's going to push her foot down towards the table as I'm resisting her, and we're going to do a 5-second isometric contraction. So we're going to get Olivia to relax. Now what we're going to do, the therapist is then going to passively bring the individual through a little bit more hip flexion to the new barrier. And we are going to repeat that. Another isometric contraction, pushing down towards the table. Good, relax. We're going to relax, have the patient relax and bring them passively a bit through more hip flexion. We're going to repeat that 3 to 5 times. The next one is a contract relax. When we say contract, this is talking about a concentric contraction. So we're going to go into the same position, that hip flexion position, into a nice stretch position. Instead of isometrically contracting, now what we're going to do is Olivia is going to bring her foot down towards the table, resisting against the therapist. Once the new range or the range of motion is done, we're going to bring her back up through the range of motion passively to a new barrier. All right, Olivia, you ready? Mm-hmm. Have Olivia relax, and we're going to bring her back up passively through that range of motion. We're going to repeat again. And passively bring her back through the range of motion. Once again, repeating 3 to 5 times. And the third one we're going to do is a hold relax with an agonist contraction. So this time, we're going to go back to that isometric contraction. Bring her up passively into that range of motion. We're going to have her isometrically contract, push her leg down towards the table isometrically, push against the therapist. Good, have them relax. And then she's now going to actively use her hip flexors to pull her into a new barrier, into more hip flexion. Awesome. We're going to repeat that. Isometric contraction, holding for 5 seconds. We're going to relax, and she's going to actively use her hip flexors to bring her further into the range of motion. And we're going to complete all of these 3 to 5 times. We're going to hold for 10 seconds after each contraction.